Hello, this is Danita Hester from Training and Development, and I'm going to give you an overview of Interactive View / INO tab. If you go to your menu after you've opened the patient's chart, go to your menu and find Interactive View / INO and go ahead and click on that. It will take you into what we call Interactive View. Now, I had already reset my search here, but when you open it, it's probably going to look a little bit more something like this, okay? So I have my menu, table of contents menu to the left. In the middle here, this area that has these different tabs in it, this is called a navigator. These tabs are called bands, and each band, such as the Adult Quick View, are going to contain different sections. So this is where I'm going to find my vital signs section, and I can come over here to my view window and see the different individual charting elements in that section. The time frames default to hourly time frames. It's really recommended that you change that, just because if you, for any reason, go back to chart, like I did something at 6 a.m. and I'm going to go back and chart it, it's going to timestamp it for the top of the hour. So it's not going to be quite as accurate as if you use actual time or if you use the insert date and time feature, and I'll show you that. So to change your time, you just right-click on one of the time boxes here, the time frame boxes, select actual, and then you can see also there when I right-click, so that changed it to actual time. And when I right-click on that, then I also have an insert date time feature, so I can do that, and then I can actually enter in my approximate time that I need to back time to, and that is the preferred way for back timing. Okay, so then it creates a column for me to chart. My view window here, this is where Cerner looks the most like Microsoft Excel spreadsheet, and that's what it's built in. So if you're familiar with that program, then this is going to be a little bit easier for you to learn and navigate. So this is my view. The current time will always be the column on to the farthest left, and then as time goes on, your later times past dates are all going to filter over to the right. You can change your time frame if you look at this gray bar here. Currently, I'm just using looking at the last 24 hours. I change those time frames by right-clicking, and then I can select, and let me do a quick refresh here. Go ahead and save some of that documentation. Right-click, and then I can select last 48, last 72. If I select other, I can actually select a clinical range. So maybe today's Friday and I haven't worked since Sunday, and I want to review all the charting for the last few days. Then I can actually change that. I can either scroll with the number up or down, or I can use my arrow here. Okay, and I'm going to say, okay, when you do that, it's actually going to want you to switch to it will actually switch you to actual time as well. So then I can look at any charting, which this patient's not had any charting in the last 5 days. But that's a nice way to go back, especially on things that you're wanting to see if their patients improved or worse, such as like lung sounds. Maybe I'm hearing some crackles or some coarse lung sounds. I want to review previous physical assessments to see if that's what's been happening with this patient or if this is a new onset. Okay, so to chart, it's really actually a couple of ways you can chart. You can either double click every box, which I really don't recommend because it just takes a little bit of extra time to go through everything. I'm going to hit right up here. Underneath the little house is the green check marks where we sign. This little circle here I can cancel, so we'll go ahead and do that so it will clear what I just did. The best way to chart is just to double click the time. So when you double click the time, it will actually throw a check mark in the top of each section box there, and then you will be able to, it will actually just go ahead and open up that first element, charting element, and you can go ahead and select that. If there's one that you're not going to chart on, you can either hit the Enter key on your keyboard or Tab. As I'm right-handed, I point and click and enter in results with my right hand, and I tab with my left. So let's go ahead and throw a temperature in here, a heart rate, and then just tab, enter my results. Oops, better pull that out of there. Ha! Get rid of that, so I'm just going to backspace that out, or I can hit cut. There we go. Let's see, 16. My blood pressure, please notice this field is for if you're using a manual cuff. If you go down a little bit further, you'll find the one that says SBP/DBP monitored, and that is we're using the electronic devices, and that's the one you want to use, or if you're using like a Philips monitor or something like that. So I'm going to go ahead and throw in my blood pressure, hit tab, then these fields where you have boxes, you could actually pick multiple, which is kind of interesting for blood pressure, but I'm going to go ahead and uncheck that. And you see how it calculated my mean arterial pressure for me. I can enter in my SpO2, and when I enter in a field there, then it's going to pop up in another field. This is called a conditional field, in which I have to enter the location of that probe. See, our patient's on some room air. And we're going to skip the end-tidal CO2, and you can see I can just keep hitting tab and keep working my way down this list. Okay, so there's my pain, no actual pain. If I don't want to just keep working, hitting tab, just because I'm not going to put anything else in this category, I can go over here to my navigator, and I can just click on the next field that I'm going to chart in. So maybe I'm going to chart in measurements next. So I'm going to go ahead and put in, let's say we did a daily weight for this patient, and we used the stand-up scale. Okay, so I can just go to the fields in that area that I need to chart. Once I charted everything in this section, or in this band, I'm going to go ahead and click my sign button. You'll notice the text turned from purple to black. Alright, so now let's go ahead, for nurses, we're going to go ahead and jump down to Adult Systems Assessment. And you will see that the items that I charted in the Adult Quick View, if there are any of those fields in the Adult Systems Assessment, it automatically fills those in. So I'm going to go ahead and right click here again, go to Actual. Unfortunately, it doesn't save that setting from band to band. And then over here, you will notice that it kind of jumps from like vital signs to Henrich 2, the fall risk scale. That's because those are the only two fields under that band that are highlighted. So for items that I want to chart on, I actually have to select them from this area first, within the band. I have to select the sections I want to chart on. So I'm going to go ahead and maybe do some mental status, the rest of respiratory breath sounds, cardiovascular, some gastrointestinal, genitourinary. Okay, so then I can double click my time, and it will take me to the top of my box, top of my column there. Since I just charted the vital signs, I really don't want to chart those again, but I do want to show you real quick. Oops, I think I just froze. I do want to show you what happens when we have abnormal results. Okay, so when I have an abnormal result, let me put in an elevated temperature here. I'm going to go ahead and sign that. You see how that color changed? It is now kind of an orangey color, and I have an up arrow. If I get a low result, so maybe I put in 8 for a respiratory rate and sign that, it's going to be blue with a down arrow. If I get anything that's critical, then I'm going to get this message. First off, that's saying this is outside the defined critical limits. Do you want to accept it? I'm going to go ahead and say yes. And sign it. And then you'll notice I get this bright red with the exclamation mark. So our CNAs are PCTs, patient care technicians are instructed to notify the nurse anytime they have a color change, which these parameters match our policy normal and abnormal parameters. So they're also instructed to put a comment in. So to put a comment in, you either just right-click on an item, select Add Comment, and notified Mary RN. And we do ask them to put the name of the person that they notified into this field. Okay. To finish turning on my assessment, I'm just going to double click that time, and it is going to throw in all those sections that I selected over here under the band. It's going to put, you'll see those over here in the profile window. It's going to put check marks in the title section title box there, so you can see those. And now I can just go ahead and chart all the way down my column there, so I can just keep on going. I don't have to double click every box is what I'm trying to get at, and it really just streamlines your charting. Okay, so I'm going to go ahead and hit sign, and now I've documented my physical assessment. If I get looking at a chart and I realize, oh my goodness, I put that information on the wrong patient. So like, let's look at my first column of vital signs. I have very conflicting vitals within a few minutes of each other. Maybe I realized that I was looking at a different patient's notes when I entered my first set of vitals. So I can unchart that. So to unchart, I'm just going to right click on the field that I want to unchart, select unchart. I do have to identify a reason why I'm uncharting, so I'm just going to click this drop down and select charted on incorrect patient, and then sign. It will mark it an error. It also throws in this little box that shows the comment. So anytime you see these little boxes, and we can actually even that one that we put the abnormal result with that comment, we can hover over those little black carrots or triangles in the corner, and it'll pop up the comment. If you want to unchart the entire vital signs assessment, then you can just left click once, hold that down, and drag and highlight everything that you want to unchart. Then right click, select unchart, identify your reason, and sign. And it will mark them all in error. Sadly, you cannot do an entire column at one time. You have to do it section by section. Okay, so if you charted an incorrect physical assessment on somebody, you'll have to do each section at a time. You can also customize interactive view. So for instance, you need to add something in. So you're a nurse and you're working with a patient who has a feeding tube, and you're looking under gastrointestinal and not really seeing anything in this section for a feeding tube to document the patient's feeding tube. That is an indicator that you probably need to add that in through Customize View. Customize View is this little icon right here. It looks a little bit like a pencil eraser over a graph, and you can, and when you hover over it, it says Customize View. I'm going to go ahead and click on that. And it's going to open a window that allows me to add additional charting elements. So if it's a section, it's going to have this little caret or triangle beside it, and it's going to be highlighted all the way across. It will have an option for on view or default open, and default open means it's just going to be open in your view window when you open interactive view, and you won't have to select it from that navigator list to the left. But you can see there are several individual charting elements that I could select. Maybe they're having some eating difficulties, so you could select that. But I'm looking for feeding tube. So to find feeding tube, it's going to be an entire section. You can use the search. Okay, but I've kind of found that's great. That is a good way to find individual charting elements, but it's not great for finding sections that you need to add in. So one of the things that I found that you can do is click this collapse all button here at the bottom of this window, and then it will show me the names of all the sections that are available in Adult Systems Assessment. If they have a check in a box, it means that it's added in already. Items that are gray with the check in the box means they're required and we can't remove those. However, there's my feeding tube. You see that? So I'm just going to go ahead and select that, and I like things just to default open because I'm about less clicks, so I'm going to check that. Then it's going to go ahead and put check marks in all the boxes associated with that feeding tube section. I'll go ahead and hit OK, and now I have a place in the Adult Systems Assessment band to chart my feeding tube. Okay, so I'll do a little double click there, reposition it maybe, nasogastric. Okay, so that's kind of how all that works. Let me go over that one more time. Maybe your patient also has an ostomy and you're noticing there's no place to chart your ostomy. Again, click on the Customize View, click Collapse All, and then I can find GI Ostomy section here. Go ahead and click Default Open, select OK, and now it gives me my ostomy. Now, as we're looking at our ostomy section here, I'm noticing that it didn't really create any place for me to chart assessments. However, when I look compared to other sections, I'll notice this one has this little square, and when I hover over it, it says Add Dynamic Group. So I'm going to build a label for this ostomy. And you guys are going to do a lot of these. You're going to do it for catheters, for your IVs, for central lines. These dynamic groups are pretty common for nursing. So in here, I'm just going to say my patient has a colostomy. It's established. It's in the left lower quadrant. And maybe they're also continent because of its location, and it's distal. We're going to say OK, and now I have a place that I can chart on that ostomy. I'll click my tongue here. It's regular, and so if you measure it, you can enter that information there. It's red, and so on. Okay, so we'll go ahead and sign all that charting. So those are adding in dynamic groups. That's customizing your view. I've shown you uncharting, and if you have to chart in the same time frame, so maybe you did an assessment at 8:50 and you just put the wrong information in, you can just use that insert, right click, insert date time, and just enter in the same time frame. It'll create another column. Just do something real brief here. Okay, I'm going to go ahead and sign it, and I just want you to see that your time frame will then have this 2 in brackets indicating there's more than one result. The most current results are the ones that will be charted that you will see. To look at details of the elements that have been charted, just right click, go into View Result Details, and then you'll be able to see that information here. Well, on the result, you can click on Action List, and you can actually see who charted it. So that's a rundown of your interactive view. If you have any questions, you can always give me a call in Training Development. My extension is 4029, and I'll be happy to address any of those questions that you have. Thank you.